Hello everybody and welcome back to my channel. I'm sorry about the lighting at the moment. I'm just sorting all my camera equipment out. My lights have some of my lights have gone down, so I'm repairing them. So anyway, thank you for watching my videos, and I hope everybody listened to what I was saying in the last video, because this is a follow-on video to go on that details, which was about a little about me. That's how I call it. I don't know whether I'll say it's a bit about me or a little about me. But anyway, as you see in front of you here, this is the medication I'm on. So this is some of the medication. This is what I use to keep myself alive. Like I said in my last video, after my major heart attack, I've had about 20 major heart attacks since then. And I have they've now, my heart is damaged. The heart was fine at one point, but it's now damaged. So this is why, another reason why I took up YouTube. To be honest, without YouTube I wouldn't be here now. YouTube's given me something to do, something I can handle. Although it isn't a living, but I'm not even monetized yet. But this is what I do to keep my mind occupied, keep myself off things, and keep myself alive and all, because it helps me with my exercise. Because I can't exercise not every day. So here's a list of what I did, my ailments from the heart attack, and I had major heart surgery. I got diagnosed with emphysema, and I'm in stage 2 emphysema, I think it is. I got diagnosed with epilepsy, because the thing when something happened to my brain when they were trying to take me off the ventilator after this all got found out about 10 months after. They didn't realise I was taking fits. So I ended up having tonic-clonic seizures. I had quite a few of them. I've got the medication now. That's stopped. Luckily, touch wood, I only have mild, what do I call it? Well, it's not memory loss, because I'll come to that one shortly. Diabetes type 2. My blood sugar levels were knocking like 128 and 136 and all this lot, and still are. It's very hard. I'm finding it very hard to control my diabetes at the moment, because my feet and my hands have gone. All the nerve endings have gone in my feet and my hands. I'm trying my hardest to do everything I can to try and get, but I think some of this medication is also I'm blaming some of the medication for the diabetes. Believe me, I have tried to get off some of this medication, but when I stop even one tablet, it just goes. I just go, and that's it. I'm in hospital. So I have my daily routine 3 times a day of taking my tablets, taking my medication, which you can see there. I'll go through it all. I'll let you know what I'm taking, and that'll explain some of them. I also have it's a mental condition now. I don't know if it is. They said it was caused through brain trauma. I have a thing called disassociation, and the disassociation comes on different levels and different things. The doctors said I've got all of it. They said my IQ is still up there with Einstein though, but it's just because of my memory loss. Like even now I'm talking to you, I'll probably forget about this conversation. Like some of the videos I've done in the past, I've forgot completely. I don't even know they're there. I don't even know what they're about. I just can't remember. My life, there's lots about my childhood I've forgotten about, and I just need, and there's other stuff that I so want to remember clearly, and I can't. And it got me down, so I ended up being depressed. I had deep depression and all that, and stuff like that. And then so I have now got the epilepsy, diabetes, emphysema, and oh, what's the other one? Heart failure. There's another one. There's some more. I can't remember all of them. So you know, the medication there for any doctors that might be watching my channel. I hope there is. I wish there was. I mean, it'd be nice for doctors to watch my channel. I'll just go through the medication. So if anyone, you know, if you know what I'm taking it for, and I haven't mentioned it, what my illnesses are, I'll go. So I'll start now. So this is aspirin. As you can see, I've turned everything up down so you can't see the name on the prescription, but I take like 75 ml aspirin every morning. I have to take that. That keeps my blood thin so that my heart doesn't block up again. I take 75 mils. Is there 75 mils of a tablet called? It's a film coated tablet. It's called Clopidogrel. That's for my heart. I know that. That's to keep my heart beating. And I have this one here is hang on, there we go. It's called sitagliptin. I think these are for my heart. It's film coated, each tablet, and they're 100 milligrams of sitagliptin. If you can see it there, hang on, I just hold it close up there. See it just below where it says film coated tablets. And I take 100 mils of them. 1 minute, I'll just check the back of it, and I take them. One a day on them, so I'm glad on that. The Clopidogrel I take twice a day. So we now go on to the next thing. I'm taking metformin. That, I know that's for the diabetes. I'm taking metformin 500 milligrams. I take that 3 times a day after meals, and that's for the, I know that's for my diabetes, which not really helping much at the moment. I've refused. They wanted me to go on the injections. I've refused because I said that I'm not doing it. I can't be bothered with it. I've had enough of all this medication. The next one is what's it called? Sertraline. There we are. Sertraline, 100 milligrams. I have to take that. Let's have a look. Yeah, that's for my heart. I know that because I'm not allowed to, it says I'm not allowed to take any grapefruit products because it cancels that medication out and I'll have an heart attack. This one here, 1 minute, I'll try and find. What I'll do is I'll actually pull the label off this one because it doesn't say nothing on the sides of it. I'll check to see how many times a day, because I don't actually do this. I have to take this twice a day. So I'll take that. I'll take all the. I have to take the identification stuff off because I don't want people coming here because they'll know I'm on some medications that, you know, junkies like. I'm not high at the moment. Anyway, this stuff is it's Foster 100/6, and it's micrograms per actuation pressurized inhalation solution. It's one of my nebula inhalers for my condition because I have acute asthma, so that's what that's for. And this is there we are, right, prochlorperazine. Can you see it there? And there's 84 tablets in there. 5 milligrams. This is a new drug, and when I first got this drug, I think let's have a look. 3 times a day, yeah. It makes you sleepy, yeah. And so I think this is the new drug, and it knocks exactly 20 beats off my heartbeat. I think. I don't know, but I'm not sure if that's the one. But I know I got told by a doctor that it knocks exactly 20 beats off my heartbeat. And then I have this one here. This is I'll see if I can get it up to there so you can see that. Well, there it's Adizem, Ditazem hydrochloride. There, if you can read there, just below there. See the Dyson hydrochloride there. It's 180 milligram each tablet, and I have to take this one daily. That's that one. I don't know what it's for. I think it's, I'm not sure. I think it could be for my heart and my lungs. I don't know. This is for my heart. It's Spironolactone 25 milligrams each tablet. Spironolactone. I've took the no, it lives on the back still, on the front actually. So there it is. It's Spironolactone. That's the name of it. And I take 25 milligram tablets. And these I have to take one every morning, just after I've eaten, for, you know, like my breakfast. So that's that one. Everyone knows what this is. Zomorph. These are 10 milligram tablets. I have to take 2 morning, 2 afternoon, and 2 evening. I'm on. So every 6 hours I take 2. 20 milligrams of Zomorph. That's the, you know, the morphine mix. It's got morphine in it and it's nice. Gives you a high, doesn't it? It's supposed to. What's it called? Carbachostine 375 milligram capsules. Hard. So I'll just read the on the back. One to be taken 3 times a day. I don't know what I'm not reading all the stuff inside, you know, but this is I'm just showing you, as promised, the medication I was on, Carbachostine, whatever it is. And I have to take that 3 times a day. And I think a lot of asthmatics will know what this is. This is Salamol CFC3 inhaler, sulfate. I have to take that if and when needed. It's the the emergency one. Paracetamol. I have to take these. I still have a lot of pain. Oh yeah, I forgot to mention. I have 4 hernias. I've got an incision hernia, spinal hernia. It's called a huge abdominal area. What do they call it? Gigantic hernia. And I also have oh, I've forgotten the name of the other one. They were going to operate on one, but they stopped. When they've done all the tests and all that, they just won't operate on them. I need one badly because I'm in absolute agony. That's one of the reasons I take the Zomorph, but also because my heart and all is giving me a lot of jibs. My heart, you know, your heart is in a sack, and my heart fell out of the sack and it's now not in the place it should be, which is kind of almost middle of your chest. Well, middle of your chest. It's now gone right over my left hand side, and as I'm breathing I'm getting pressure onto my heart. So that's what's making my heart, it tends to be a little bit bumpy, a bumpy ride. So I take the paracetamol with the and the Zomorph. I knock up on my pain when I'm in absolute agony. What happens is when my stomach goes into a spasm, I can't bend down, can't touch the floor, can't bend my knees or anything like that, because my stomach is like, it looks like I'm fat, that I'm overweight, but I'm actually not. It's just my stomach, and it's because of these 4 hernias that's in there. And they said they do need to operate on one because it tore through my stomach wall, but they can't now. They don't think I'll survive an operation of any kind. I had to go and get my teeth out. I'm not kidding you, it's bad. I had to go and get a tooth out. I had to go to hospital for it, and they had a heart specialist, a lung specialist, and you know, all these specialists out just to take a blooming tooth out. And I had to go through all that rigmarole. They can't put me out, so they said they're just going to whack the hell out of my face with the is it the morphine or whatever they use, what they call it, and they, you know, monitor my vitals while they go. They had a life support ready for me and all this lot. Whilst they were doing it, and oh, I forgot his name, the guy that knocks you out, he said he's going to give me a little bit of stuff. He said it'll make you just a little bit happy, but you won't be going to sleep. And I said, yeah, that's fine. I said, put me out if you want. I said, I'm not scared. They said, no, we can't do that. And anyway, I had to go. I went last year, well, at the end of last, no, it was at the beginning of this year. I went to see another consultant over in the hospital, and he's told me after he said, I've already case studied your case. He said, we can't do it. He said, we're not going to touch it. He said, when we patients walk in here, we like them to walk out. And they said, we're 99% sure you're not going to walk out. And I said, so, alright. And I said, how am I going? He said, yeah, if you could live with it, he said, we'll try and help you to live with it, and that's it. That's all I could do. And then what'll happen is, if I have like a heart attack, because one of my right vents is, it's folded up for some reason. I don't know why. They haven't said, I can't remember what they said about it. One of my right vents is actually damaged again. This is one they've done. But another consultant, she said that it's twisted, and that's what's causing the blockage on it. And she said, and that is due to the operation. She said they've not done it right. So I'm not arguing with anybody. I just had enough of it all. I really did. I was in hospital for over a year. I got out for a day, and then I was back in for a couple of weeks, and sometimes a couple of months, and then I was out for a day and I was back. I just had enough of it all, and I didn't care whether I lived or died. If you get what I mean. I just walked out. I got out of hospital. I signed out the last time, and now the doctors understand, and they've said it's okay, but they said, we need, if you want, you have to come. Please come and see us. And I said, okay. So occasionally I do go and see the doctors, but yeah. Here's the next one. I think this is for my mental condition. What's it called? It's called Progabalin Milfarm. 150 milligrams, and I have to take this twice a day. I got to admit, it does make me feel a lot better. I mean, a nurse once asked me if I'm afraid of dying. I said no. I really don't have no fear of dying. I don't know why. I'm not going to explain it. I'm not trying to say I'm brave or anything like that. I just say one thing. I'm not afraid of dying. After all the heart attacks I've had, and you know, you're going out, and I know what it is, and you expect not to come back sometimes. I don't know what it is. I just feel like dying is not hard, you know. I just feel, I'm not saying you go to another world. I'm not saying you're going up the pearly steps or out like that. I don't know. But I just got this feeling after my first heart attack that there's nothing to be afraid of. If you get what I mean, if you get what I'm saying. So I'm not saying, you know, go out and kill yourself or anything like that. I'm saying if you are in that way, you do feel like that, like I did. I tried to kill myself. I was saved by the doctor when she came in. The doctor used to just pop in and see me when I managed to get a few days home. And I'd got a load of this medication, piled it all up, and I put a magazine over it so the doctor couldn't see it when she walked in, because she used to just knock and walk in the house. She was lovely, brilliant doctor, absolute brilliant doctor. And she used to shut a coat off, shut it on a chair, and sit on the set and eat next to me, and all that. And then all of a sudden one day she just walked. Now I thought she didn't see anything, and then she just said, "No." And she started like that. It's nice how they stroke your shoulder. It's kind of showing you that they care. And she said to me, she said, "You aren't thinking about hurting yourself, are you?" I went, "Me, no, no, no." I said, "I wouldn't do that." And she said, "You've got no, you know, no worries now. You've got no thoughts about harming yourself in any way." I said, "No, no." I said, "I wouldn't do that." And then she took the magazine up the tablets. I'm like, oh God, I felt so foolish. But I was going to do it, and she stopped me. And then from that point on, she was there every day. And sometimes she'd come twice a day. As she was driving past my house, she would pop in and see me. And there was another time when I did feel like, but I stopped. I was thinking about what she said. What she said, she was so good at the way she'd done it, and she was a GP. And her husband is a paediatric consultant. And, you know, fantastic. That doctor, she cared, and she knew her business too. And she was working in A&E, she said. I believe everything she said, and she is an angel. Anyway, so what they done, I've got diagnosed with this mental health condition. That's why I take that. I know that Progabalin's for it. This is for my lungs. This is called Akira Genuaire. 322 micrograms. It's inhalation powder, and it's called Alcidinium aclidinium bromide. I've heard the name bromide before. So yeah, it might be the thing. Keep out the sight of children. Yeah. And I have to take one inhaler containing 60 doses, so it's one inhaler containing 60 doses. So I like click it, and then as it does it, and I have to take this inhale twice a day and all that, you know, go through all that. So I have to take that twice a day. It's getting full on this side, so I don't know if anyone's counting. My Ventolin Nebules, 2.5 mils. I put 2 of them into my thing, into my machine. I'll show you it shortly. I have to put these in. I'll stand them on top of the machine so that you know what it is, and I'll show you a bit about that machine. So I'll just put that there, and I take that if and when needed, the Ventolin, but I also take it. I have to take it. It says hang on, 3 times a day if I take it on a normal thing, but I can use it when my lungs get a bit weak and decide to, you know, try and slow me down, and so I get onto my nebulizer and take some nebulizer. I also have Astro, there it is there, Atorvastatin coating. Obviously everyone knows what the statins are, and I'm on 80 milligrams per tablet, which I take that before I go to bed. That's for my heart, so everybody, when you got a bad heart, and especially to stop bad hearts. I mean, a lot of people might have heard a lot of controversy about it on the thing, but to be honest, I mean, it's saving me. It's not caused no side effects for me. All my side effects, well, all my effects is not side effects, they're all effects. So then we go on to this one here, which this one is Rampril. I know that's for my heart. 10 milligram capsules of Rampril I have to take, and I have to take these tablets one a day. A 10 milligram tablet it is, and I have to take these once a day, which is for my heart. I know that much. And finally, this is finally on this. This is my, sorry, that Ventolin is my inhaler, and this is my Salbutamol 2.5 mil by 2.5 mil nebulizer solution. I'll just put it there because I'm not supposed to show anything. There's nebulizer solution, and what I put in my nebulizer machine. So I'm now getting to the nebulizer machine. I'll just put that there in a minute. Right, I'll move this lot out the road. First I'll swing the camera around. I'm going to bring you down now, and I'm just going to swing you around to this machine here. If you can see it, there it is there. This is my oxygen machine. This is what, I'm just checking to see whether I can see you. This is what I have to use every day when I get short of breath. Now, I'll take about a lot, if people know about oxygen, like supplement oxygen, you may have heard it on news past with Donald Trump, supposed to be on supplement oxygen. When you can't breathe, that's what happens to me. Sometimes I think what it is, I get massive pain in my left side, it's my left lung, and it feels like my left lung stopped and it's starting to deflate. So I go on the oxygen machine and pump it up. I get on it. Sometimes I can be on it 10 minutes, sometimes I'm on it 2 hours. I try and keep the dose as low as I can, and I refuse to go on it unless my oxygen levels have dropped, because my oxygen levels just drop at will. They just drop when they want to, and it just comes on so quickly. I don't know whether it's my oxygen, so I have to do things differently. So I might put one of my nebulae on there, but other than that, it's got a cannula. Where is it? It's round there somewhere. I'll have to get this pipe replaced. It's got a cannula on it where I just put my nose, and it helps me breathe. And that's the settings there. Just turn that knob down there. Now, what it is, it depends on the volume that you're pumping into you on the thing. I like to keep it on around about 2 or 3 if I can keep it below 3 all the time, which that's what I make sure I do. But I'd rather keep it below 2 if I can. Sometimes I might be on it a bit longer because I've got it down onto like 2, and and I know I should pump it up so I can get it done fast, but I'm not. I thought I'll just try and build my lungs up. because I don't want my lungs becoming dependent on that. Not only that, too much oxygen can kill you, and I know that. So I do have an oximeter and a blood pressure machine. My oximeter, the first thing that my assistant does is she checks my oxygen. She also checks my blood pressure. Sometimes I might be unconscious and it might be that's caused it. So my assistant, she's been trained out to do it. She checks my oxygen and my blood pressure, and then she can put me on the appropriate thing, and it does bring me back round. Sometimes if I've had a fit and she sees my oxygen levels drop right low, she'll make me comfortable in that, and then she'll just stick that out. My oxygen levels come back up, and then she'll turn it off. That's how she does it, and that's how I prefer it. So yeah, everything, I like to do everything, and I would like to come off most of this medication. Now there's one thing I've told the doctors, I want to come off the morphine, because I do know Hitler was on it, and also Napoleon. I'm hooked. I know I'm hooked. I mean, I've had morphine now for about 5 years, 6 years, and I don't want to be on that. I don't want to be on any of these tablets, to be honest. I want to be able to run and jog and do that. Anyway, we're coming across to my nebulizer. I'm just going to bring it back up and point it down. There we are. And this is the last of it I'm going to talk about. So as you can see, this is my trusted. I've had this since I came out of hospital the first time. We had to buy, I got one given. This is a new tube and mask that has to go on. That's where I put my nebuli into that. My lid's broke off my trusted machine, but it still works like a good one. And I just plug my pipe there onto there, pour 2 of the this stuff on, the solution. I pour 2 of these into there, and then I'm away. And I take it 3 times a day. And then even if after I've took it, if I end up, what happens is when I can't breathe, that one I know I take that this machine. Oh, sorry, I'm talking about, and I haven't even turned it round. This machine, that's the on-off switch there. It's just so easy, and I plug my this mask here into there. I'll take that out. I have a few of these. Now these are all supplied. I have to supply these myself. I have to buy these myself because the nebulizer, you can get one off the NHS, but they mess about coming around, taking them and all this, like where you can just actually buy them. So I just bought them. They're only cheap. And that's the filters where I have to put new filters in and all that, but they supply the filters, give me filters for it anyway. And this here, I just got this off the doctors. The doctors will give me the tubes and the solution, that's all free. So all I had to do was just buy the machine. I didn't have to buy the machine, I could have used the NHS one, but you know, there was a shortage of machines at the time when I got them because David Cameron had just... And yeah. Anyway, I'm going to say great big thanks and goodbye.